So in terms of reducing the incidence of cancer, there's a few things that can be done. And sometimes it's looking at each cancer individually and looking at what the most prevalent cancers are. So in the case of cervical cancer, one of the most effective things you can do is have a vaccine for it. It's a HPV vaccine, which has been shown to be quite effective. And this has been rolled out by the government here, and it's been given to young girls, and it's a really effective tool to ultimately combat what is essentially a sexually transmitted disease in a sense. And this is a very effective modality, and we need to look into vaccines for this and maybe other virally associated cancers as well. Screening is also the core of it, and screening is a process by which the most prevalent cancers are identified at an early stage, and these usually have some sort of effective treatment, particularly when they're discovered at an early stage. And these are important things, so being aware of your breast, self-examination, having your mammograms at an appropriate age when you turn 45 or above, and having your pap smears done when you become sexually active from the age of 25 as well. For males and females over the age of 50, and those with high risk factors, to have colonoscopies, and also to cut down on risk factors. So watching your diet, eating good food, mostly plant-based whole foods, and cutting down on refined foods and high amounts of processed foods, red meats, and those kind of foods, but also other poor habits or bad habits like smoking, and excessive amounts of alcohol can also be a problem. So there are dietary factors to look at, lifestyle factors to look at, and cutting down your weight and keeping your weight down is also important in decreasing the epidemic of cancer.